Ahead on Daytime Buffalo, Recovery Options Made Easy is here to tell us about all of their mental health resources so that you can start 2024 with some peace of mind. And we get a special performance from an up-and-coming artist, Captivated Sea. It's all coming up right now on Daytime Buffalo. Good afternoon, hello, and welcome to Daytime Buffalo. I'm your host, Chelsea Lavelle. Joining me now in the Daytime Buffalo studio is Jennifer and Lisa of Recovery Options Made Easy. Hi, ladies. Thanks for joining me.
Hello. Thank you so much.
Now, we've had you on the show before, and for those who might have missed it in the first place, tell me a little bit about Rome and your peer wellness-driven program.
Sure. So Recovery Options Made Easy is a peer-run organization serving really all of New York State, but we're based locally here in Western New York. And we provide community services to anyone who is looking for support to remain active and independent and mentally well in the community.
Now, you started something called Warm Lines. Tell us about that.
So we actually operate two warm lines, one out of Erie County and one out of Chautauqua and Cattaraugus County. And these warm lines are available every day from 4 p.m. to 11 p.m. to anyone who is in need of support services, a friendly ear to listen, but also to provide expertise in what might be available to them in the community.
Now, a lot of people have thought of you guys when it comes to addictions and substance abuse, but that's actually not all that you guys do explicitly, right?
Sure. So one of our tenets is really meeting all of the participants we serve where they are with whatever they self-identify that they want to work towards. So that may look like a substance abuse issue, that may look like a mental health and wellness issue.
And starting out the new year, right, you were telling me this is the time where people focus on wellness. It's just the easiest goal to have, and that's kind of a great place to start with you, right?
It is. You know, this is the time of year where people are really setting those personalized goals that they have for themselves. And again, that really fits in with our tenet of we want to work with the people that we serve on their self-identified goal. You know, whether it's support, whether it's resources, a friendly, understanding ear. And what makes us so special is our credentialed peer specialists are coming from that I've been where you are place. So right. These, you know, when we're talking about peers, we're talking about peers in the community that have that firsthand knowledge. So you're really talking to someone who can provide that sense of I've been where you are and it's possible.
Now, how long have you been with the program?
I am new to the program.
Okay.
So I am pretty much 3 months.
Okay. Are you a peer counselor?
No, I am the director of clinical programs.
Okay. Tell me about your involvement so far. You're new to the program, but you seem to like it.
Yes, I do. So far, so great. I love basically what the agency stands for, the way that they take care of our participants and the way that they train our staff, very hands-on, so I'm very impressed so far.
Let's talk about the process of when someone comes to you looking for help.
Sure. So for our warm line services, that's all telephonic. I think you guys will be promoting our numbers later on, but so someone calls, they're going to be connected with a peer specialist who is there to listen and to provide that support and resources. And then in terms of our respite services, these are really extremely short-term programs to provide a safe, supportive environment. Again, you know, the participants we serve have self-identified goals that they are actively working towards. Again, those numbers and on our website, all of that information is available. Someone reaches out, again, they're gonna get in touch with a peer support specialist to really walk them through what's going on, what those challenges are, what their goal is, and really figure out how we can best assist them in meeting that goal.
Now, warm line is a new term that I've never heard until now. What is the difference between a warm line and a hot line?
So kind of like the temperature implies, so a warm line is really just, I'm thinking about this, more supportive services. You know, a hotline is when you're kind of in that more crisis moment and in need of an immediate response. We do have those programs that are face-to-face, but a warm line is really, we're just there to provide that linkage, referral, and support.
And let's talk about some of the local causes that you've partnered with in the past.
Sure. So both of the warm line and our respite services are operated out of our Kirsten Vincent Respite and Recovery Center, which is located on Maple Street, right in downtown Buffalo. So we're really active in that community and making sure that all of our community members have access to our services and know what we're about. We are part of the Fruit Belt Coalition, the Fruit of the City down there. So our most recent event was their Christmas celebration, where we were able to send some staff and some board members to provide supportive services in those communities. We also over the summer did dancing in the streets with our local partner BFNC. So we really want to get out there, get into the community, have these ongoing conversations about mental health and mental wellness, and really integrate that into the fabric of the community.
Nice. Jennifer and Lisa, thank you so much for coming in.
you.
Viewers, if you would like to find more about their service and their community outreach, head over to recoveryoptionsny.org or call one of their warm lines listed on the screen. Thanks again, ladies, for coming in.
Thank you
you.
so much. Have a good day.